Welcome back to What Really Matters, listeners. Good to have you with us again. Tackling the issue of healthcare again, we have Doug Jones, 24-year veteran from Eden Hospital, member of the United Health Workers, the second largest union in the nation, as well as a 3-year veteran of the healthcare legislative struggle, and a guy who spent 4 months this summer trying to get California healthcare reform taken care of. Doug, it's good to have you on the show.
Thanks for having me on. I appreciate it.
Listeners, you may ask, do I tackle healthcare? Here are a few statistics. Every 4 minutes, a baby is born to a mother who had late or no prenatal care. A baby is born without health insurance every 52 seconds, and there are 47 million Americans without health insurance, 80% of whom are working. So these aren't just poor indigent people, 80% are working, but they can't make those ends meet. In addition, listeners, bankruptcy. You know I've talked about it. You know I preach fiscal conservatism. Medical debt is the #1 reason for bankruptcy in America. That is definitely a cause for concern. Against that backdrop, Doug, I guess I'll ask you, what is the state of healthcare in America?
Well, what I've found in the 24 years that I've been involved in healthcare is that increasingly it's moved during those years to a for-profit model. Even at the not-for-profit corporations, which are numerous in California, including the corporation that runs my hospital, Sutter Health, while they're not-for-profits, they still run their organizations to be highly profitable. And what this does is that we're finding that it has consequences at the bedside. Patients are not treated with the same level of care. An example, what's happened at my hospital is that there's a position that's been created at my hospital and many other hospitals in California called utilization review.
Okay, utilization review.
Right.
What does this person do?
What this person does is that they're meant to analyze all the patients on the floor and figure out if it's time for them to be discharged. And they're just making this decision not just on a patient care standpoint, in other words, is the patient in a good enough condition to be discharged, but they're also making that decision on the basis of their insurance. They're aware...
What? How's that?
They're aware that their insurance company, for example, a certain insurance company will pay for a person with a certain type of knee surgery. They'll pay for a 1-day admission post-surgery.
Okay.
The utilization review person knows that, and in any case where it's a narrow decision as to whether the patient is in good enough condition to be discharged enough, they'll make a really strong, strident attempt to get that patient discharged, because if they're not discharged, my hospital will take a loss on their care, or the profitability of that patient will be reduced.
Listeners, I've got to say that there are two things I'd like to make as a point here, and it's a bit frustrating that healthcare has come down to a profit motive. T. Rowe Price said it best, don't begrudge me a profit. Please begrudge me the unreasonable profit. And I think that should be the guiding light. There is nothing wrong with profit. That's what our country is founded on, business. But when it comes to healthcare, and a decision is being made to send a person out of the hospital just because they might not be reimbursed by insurance, I have to say that's wrong. And if you think about it, sending a person out of the hospital early and sending them home, well, I can tell you if a relative was sent to my home, I wouldn't know how to care for them. I'm not a nurse, I'm a financial advisor. Does it really make sense to do that? Doug, what have you seen as the long-term implications of that kind of policy?
Right. Well, what is happening fairly immediately is that at hospitals here in the Bay Area and throughout the nation, the rate of readmission for patients that are discharged has increased. So what happens is that patients run a great risk of becoming sicker as a result of discharges that in many cases are too prompt.
Listeners, does that sound like fiscal conservatism to you? You get them out of the hospital so you make a short-term profit, but in the long term the same patient comes back and sicker. Now we're spending more money. Does that sound like being fiscally conservative? I don't think so. So Doug, basically what we have is something of a revolving door going on. At least I'm seeing that in America. I had hoped, though, with the film Sicko coming out, Michael Moore's piece, and I think that was in late May, early June, have we seen some change? Was that the rallying cry I had hoped for? Are you, from your time in the trenches, if I may say, have you seen substantial change?
Right. An example of how much effect the movie Sicko had, along with the efforts that we've made in California through a coalition that I've worked with called It's Our Healthcare. We had been lobbying in Sacramento for a couple of months before the movie Sicko came out. There was a special showing for legislators in Sacramento, I believe it might have been in June.
Okay.
The next day when we were going into the legislators' offices, almost all of the legislators and their staff had seen the movie. And it really is powerful and sends a message not just for the 47 million Americans that you're talking about with no health care at all in the United States, which are, my view as a healthcare worker, is profoundly immoral. But it covered most specifically Americans that do have health care insurance and are still abused by the current system.
Exactly.
And a show of the effect that Sicko had, along with the efforts that our coalition and other healthcare workers and concerned citizens had on the process here in California, is that in December of 2006 there was a poll done of Californians who had healthcare insurance, and they were asked, are they satisfied with their current healthcare insurance? A bare majority, about 52%, voted or said yes, they were happy with their healthcare insurance. A similar question was asked by the same polling agency in August of 2007. A few months later, 29% said yes. So a combination of the movie and the efforts that we have been made trying to get people attached to stories that they have about being abused under the current system meant that a quarter of the population of insured patients in California decided, you know, this isn't okay anymore. This is really something that needs to change.
Listeners, this is the richest country in the world, and I think many would argue the most powerful. And I have to agree with Doug. It is immoral that we are not taking care of our own. When you see the film Sicko, and again, take it with a grain of salt. Michael Moore likes his theatrics. We all know that. But look at the healthcare systems in other countries. Take a look at how it's done in France. Take a look how it's done in the UK. And that's not to say it's perfect. Of course it isn't. There's nothing that's perfect. Well, at least I have yet to see anything that's perfect, let's say it that way. But those systems are certainly working a damn sight better than what we have. And I've got to say, if they can do it, I don't see any reason we can't. Doug, as we start to head into the finish line on this particular segment, I would like to turn it specifically, since our listeners are here in the 9 Bay Area counties, let's turn it to California. You spent 4 months this year trying to get California healthcare reform through. There was Fabian Nunez's bill, there was Don Parada's bill, the governor was making some mumbles about trying to put out some bill that he wanted. When all was said and done, and probably a lot more was said than done, what happened?
We do feel like the final bill that was actually passed out of both houses, both the Senate and the Assembly, Assembly Bill 8, is a good, solid healthcare reform bill.
Really?
When the process started, there were 8 different areas of concern that members of my coalition had concerns about.
Okay.
By the end of the process, all of those had been substantially addressed. So it got to the point where in the last week or so before the bill was passed, we finally had a bill that members of our coalition, including my union, SEIU United Healthcare Workers, could fully support. And we urged that bill to be passed.
Well, I do feel good about that, listeners, because what concerned me as I watched the budget stalemate go on for, I believe, 55 days, is that healthcare kept getting pushed and pushed to the end of the session. And at one point, it looked like it was going to be, let's solve healthcare in 2 to 3 weeks. And that is a difficult topic to solve. But it is one that needs to be solved. Again, listen to those statistics. They don't lie. Those are Americans who need help. So what I'm hearing, Doug, as we wrap this up, the bill is passed. What is its current status?
Right. So what's happened is that the governor has vowed that he would veto this bill. I'm not sure that he has actually vetoed it yet, but what he wishes to do is, and he's called for a special session, and one of the main topics of that special session is to negotiate over that bill. In other words, he wishes AB8 to be the ceiling from which a healthcare reform proposal would be negotiated. Now, that might be done legislatively with an actual bill that's passed. What is also a possible option is that there might be something that's put before the voters in a ballot initiative that can be agreed on.
Listeners, we'll be right back, continuing our conversation with Doug Jones.